Hi, I'm Rupal Patel, registered nurse. Today we are starting a two-part discussion on dementia. This topic cannot be covered in just one episode. Dementia is a devastating disease, not only for the patient, but also for the family. One of the most confusing questions I hear is, would my loved one qualify for palliative care? This question is confusing for everyone: the patient, the family, the physician, and even the primary care. During any chronic disease, a patient goes through many phases. There are days when they're doing much better, and then there are days when it feels like no matter how much you try, the treatment and the system seem to be failing. It feels like you are taking one step forward and two steps backwards. Now, to give some background, dementia is a brain disease. For those who are not familiar with it, dementia slowly robs a person of their entire life. It takes away the biggest treasure a person has, their memories and their self-identity. And to watch a loved one being robbed of that treasure while not being able to stop it is the most devastating experience a family member can go through. Out of many, the most common types of dementia are Alzheimer's dementia, vascular dementia, Lewy body dementia, and frontotemporal dementia. Now, out of these four, let's talk about Alzheimer's dementia, which is the most common in the community. Why is that? Now, Alzheimer's can begin as early as in mid to late 60s, and it can last more than 20 years or until the patient passes away. Alzheimer's disease is caused by abnormal protein buildup in the brain, which damages the neurons. This leads to memory loss, cognitive decline, and behavioral changes that gradually worsens over time. Now, in the beginning, Alzheimer's may start with simple forgetfulness, then short-term memory loss is added. Over time, the patient may begin to forget self-care tasks, important life events, distant and close family members, and eventually may not have any awareness of what's happening around them. Now, this is extremely painful for loved ones to witness. As the disease progresses, the patient may not recognize their spouse, their children, their grandchildren, or even friends. The patient is unable to ask for help because they do not understand what is happening, and the family feels confused, lost, and emotionally exhausted watching this happen. Now, let's talk about when a family might ask for palliative care during this journey. In the very early stage, when a patient is just a little forgetful, it may seem like normal aging process. There may not be even a diagnosis at that time. Some patients may not mention these changes to their primary care provider. Some may not even have a primary care physician. Life continues as usual, and the disease continues to progress. Then comes the next stage, short-term memory loss. It becomes more noticeable. The patient forgets where they place their car keys. They forget conversations. They buy groceries again because they didn't remember buying the same ones the day before. They may get lost driving home from a routine location. At this point, the situation becomes more concerning. The patient is likely to see a physician and may receive a diagnosis of Alzheimer's dementia. Now, many questions begin. Are there medications to slow the progression? Is driving safe? Is cooking safe? Are they eating properly? What happens if they wander and cannot find their way home? The patient may be advised to stop working, stop driving, move with the family, or to an assisted living. These changes are not easy. The patient may feel irritated and frustrated. Stress increases both for patient and the family. At this stage, families often wonder, is palliative care appropriate now? Would the patient qualify? The best step is to call a palliative care provider and request an evaluation. What's the worst that can happen? They will say no. There is no harm in asking for an evaluation. In our next episode, we will discuss later stages of dementia and what may qualify a patient for palliative services. Because timing matters, and understanding the progression helps families prepare instead of reacting in crisis. Thank you for being here. I'll see you in part 2.